Cancer has been mankind's biggest threat for ages. Once you are diagnosed with the cancer, you become a cancer patient. This is not because of a tumor, but due to start of a long battle with the cancer therapies. Despite the mankind's effort to conquer the cancer, it still remains as the #1 cause of death. But if the cancer is detected early in the progression stage, the rate of cure can reach as high as 90%. This part of the Oriental Medical Digest will examine how the cancer is diagnosed and approached in Oriental medicine. Cure rate for the cancer depends on how early it is detected. Cancer cells are mutated from the normal cells. If a foreign cell or virus enters the body, then the immune system will be activated. But this is not the case with the cancer cells. Without much resistance from the body, cancer cells grow rapidly by absorbing nutrients. Cancer cells are easily transmitted to other distant organs through the blood vessels and lymphoducts. This triggers secondary growth of a tumor. There has been new technique for early detection in Oriental medicine, and it's called as wavelength diagnosis.
통상적으로 1cm의 암이 되려면 한 5년 정도 체내에서
Cancer is a mass tumor that exceeds 5 millimeters measured by state-of-the-art instruments.
새로운 진단법이 필요로
But it takes roughly 5 years for the tumor to grow this much. Oriental medicine can detect even the minutest size of cancer by applying the body's own wavelength.
Then, what is wavelength? Theory behind the wavelengths is based on the quantum physics. Each cell in the body has own wavelength. Thus blood, urine, and even heartbeat has wavelength quality, and these may be analyzed for the existence of cancer cells. The principle of wavelengths has been used for a long time in Oriental medicine. Traditional pulse diagnosis through the wavelengths of the body defines abnormalities of the organs.
This test is to determine the existence of cancer cells by measuring the wavelength and resonance wavelength specific for the cancer cells. This test measures the serum contamination. It can detect changes in the contamination level in accordance with the time progression. Cancer cells do not live in sanitary conditions, so contamination levels can suggest existence of the cancer cells. The second examination is the urine test. The wavelength is analyzed through the urine by transcribing the information of contamination in the body. If the body is contaminated by the virus, bacteria, and such, measuring the resonance of the wavelength can suggest the existence of cancer. If the contamination is apparent through these two tests, then another test is done to check the location and progression state. Digital analysis of urine yields information for the progression and location. In fact, it is not easy to understand that the cancer is diagnosed through these examinations. However, through the systematic process of these tests, the progression and location are easily found.
We were taken the result from the test. First diagram is the result of wavelengths analysis. Results from the CT scan, MRI, and tissue analysis are on the right side. What's surprising is the result on the left side. Small, invisible cancer cells are migrating to adjacent organs. This shows new possibilities of early detection for cancer. You probably haven't heard about the wave technique for treating a cancer. Viewers heard it for the first time may consider it as one of the alternative medicine for cancer. This technique is still in experimental stage. but high accuracy rate of diagnosis is worth the attention. Let's explore how the cancer is treated in Oriental medicine. In order to treat cancer, Oriental medicine considers that the body function should return to the normal state. Surgery, chemotherapy, and radiation therapy all may depreciate the body function and immune system. Cancer therapies in Oriental medicine not only boost the immune system, but also eliminate the side effects from other treatments. To relieve nausea, herbs such as insam, hwangi, and pekchur are frequently used. Sain, pekdugu, ikji are good for indigestion and lack of appetite. Anemic patients are given prepared sukji-hwang and tanggi. Baekpyeondu stops severe diarrhea. A test was done to verify the efficacy of these herbs. One group of rats were given these herbs either intravenously or orally 3 times a day for 1 month. Control group was given same food but no herbs. After 1 month, both groups were treated with radiation. Control group showed significant drop in function and intestinal protuberance tissues were damaged. On the other hand, treated group showed virtually no effects from the radiation.
Current anti-cancer therapies lay a significant burden on the patients and drops living quality. In Oriental medicine, early detected cases are focused to increase the immunity for self-treatment. For those already receiving the anti-cancer therapies, treatment is concentrated on raising the already weakened immune system.
We can have 2 concepts on how to approach the cancer. One is how to eliminate the existing cancer cells from the body, and another concept is how to prevent the cancer from breaking out in the first place. Oriental medicine's theory is perhaps closer to the latter concept by increasing the immune system of the body. If the body maintains a good energy level and normal state, then cancer should have no place in our body. Thank you for joining us today. We'll see you again next time.